Why was healthcare access so unequal in historical European societies? Imagine living in a time when your social class could determine whether you lived or died. That was often the reality in European societies hundreds of years ago. Healthcare was not something everyone could reach easily. The reason for this lies in many factors woven into the fabric of society back then. First, society was built on strict social layers. Nobles, clergy, and wealthy merchants enjoyed the best medical care, often paying for private doctors or staying in monasteries with infirmaries. Meanwhile, peasants and laborers had little to no access. They relied on folk remedies or local healers, which were often ineffective. Medical knowledge was still in its infancy. Hospitals existed but were mostly religious institutions providing basic care. It was only after the Renaissance, when science and new ideas flourished, that medical breakthroughs started to improve treatments. Still, these advances spread slowly. Wealthier cities and regions benefited first, leaving rural areas behind. Economic barriers also played a big role. Medical treatments, medicines, and travel cost money. The poor could rarely afford these, so they stayed sick or untreated. Governments did not step in much either. Public health systems and social welfare programs only appeared much later. Without state support, healthcare remained a privilege for the rich. Religious beliefs also influenced healthcare access. Many hospitals were run by religious groups, focusing more on spiritual healing than scientific medicine. Discrimination was common too. Women, minorities, and the poor often faced barriers to receiving proper care. Geography made things worse. Cities with universities and hospitals had better services, while rural areas relied on traditional healers or had no care at all. Over time, medical breakthroughs like understanding anatomy, developing vaccines, and improving surgery started to change this picture. But these innovations took centuries to reach everyone, and inequality persisted. So, the main reason healthcare was so unequal was because medical knowledge and infrastructure were limited and unevenly spread. Social and economic hierarchies kept many from getting proper care. Political and cultural systems did little to support universal access. Although progress was slow, each new discovery helped pave the way for a fairer system in the future.